I'm really coming at this from the point of view of a caring citizen and somebody who has experienced 3 deaths in my family, one of which was absolutely wonderful, and the other 2 were so awful that I still feel anguished about them.
But the lady that I remember vividly was a lady with pancreatic cancer. She was getting frustrated because she'd see these people come in, have their various procedures done and then die, you know. And she was getting frustrated that this was not happening to her. And so at one point she tearfully spoke to the consultant and said, "When is my time, you know? When can I move on?" And in my opinion, to his credit, he said, "We can help you out." So with her permission and the permission of her family, he basically commenced terminal sedation. He started an infusion of morphine and clonazepam with a top-up if she needed it. So basically rendered her unconscious. Maybe 2 days later she had passed on. He's the first person I know of who's done that for a patient, and I admire what he's done. Lots of people would say what he did was illegal. In fact, 2 nurses on the ward objected to what he had done and threatened and said they were going to report him to the authorities.
Gloria is her name, right? She was with me and a great friend for, I don't know, so 30 odd years, but yeah, more. And she died a terrible death, and then with ovarian cancer, metastatic. But the irony was, she didn't want to die. Doesn't matter. And that's her entitlement. And so she lived, in my opinion, and I want to mention this, probably too long for the poor quality of life she eventually had. But she's entitled to it.
When I've been dealing in my own case with patients who have been dying, my whole motivation in looking after them is being comfort orientated. Then I had a friend, very special, now I'll get emotional, a very special friend of mine who had a recurrence of lung cancer about 18 months ago. She was admitted as her condition deteriorated into palliative care. Unfortunately for her, that hospital admission till her death was about 10 weeks. Her main problems were respiratory, so she couldn't breathe. So she was breathless and had exaggerated breathing for all of that 10 weeks. And what really demonstrated to me that something else needed to be available to her was how she died. The end stage physical symptoms that the patient is demonstrating are very confronting. What happens to people is they lose the ability to swallow. And so if you're observing that patient, it looks as if they're choking. So when she was dying, say in that last hour, her head was rocking from side to side. And her mouth was open and her tongue was protruding a little bit. So the visual aspect of that, I think for a lay person, would be terrifying. Now, she never asked me, and we never had discussed assisted dying. But seeing what happened to her, I thought she should have had the opportunity to take that help with assisted dying if that was available.
There are traditionally accepted 12 criteria of a good death as opposed to a peaceful death, you know, and that includes autonomy, that you're making your own decisions about life and death rather than someone else doing it for you, relief of pain, and then the inability to move sufficiently. So the discomfort of that. The existential discomfort of thinking, well, why am I hanging around for goodness sake? You know, I'm not enjoying life. So I guess it's predominantly giving people autonomy where death is inevitable.
And I always remember the 3 things generally that come up when people knew they were going to die that concerned them, right? And the 3 things were, don't let us die alone, don't let us die in pain or in terrible circumstances. And the 3rd thing that was very important, we want to be remembered as we are now, not then. You know, for relatives, it's traumatic to see people. Now, if people don't want an alternative, that's their right, you know. But most people would like a choice.
You'd like to think that a Christian religion or would be one that was a very caring, very caring. I think if you looked at the teachings of Jesus Christ and the loving each other and the way that you could live together, it's a philosophy really for living together and caring for each other. Well, if you put that into the context of this, you may want to have a debate about what that religion is really doing. Are you really serving and caring for people by saying, no way?
So we start worrying about the health of someone way before they're born, up through that whole pregnancy, and we are not frightened to intervene if something goes wrong. We'll do a caesarean section or whatever is necessary. Then in life, we'll intervene, and just docs again, immediately if we can see something that needs treating, you should get in there and, fix things up if you can. And then somewhere we drop the ball. When you get to die, everyone said, oh mate, we're not allowed to touch this. This is natural to let them bloody suffer like this. Well, it is not natural, and it's unacceptable, and it needs to change.
Well, there's a small proportion of people where palliative care really can't provide all symptom relief, usually in the last few months or so of life. So there's a proportion of people who, for reasons of loss of autonomy, for carer stress, for lack of symptom relief, who would wish to have, and I think they should be permitted to have access to voluntary assisted dying.
There's some very good doctors in palliative care, don't misinterpret me, right? And they do a good job, but not all palliative care gives you that dignity or takes away the pain inevitably, right? But that's the best they got to do, and if I was stuck with that and no option, I'd learn to get on and do the best I can with what I had. But that's a lousy option when I could do far better to give people a dignified death, right, of their choosing.
I've had people hang themselves, I've had people take medication overdoses. When it does occur, it's incredibly traumatic to family members.
The options are people suicide, right? That's a terrible thing for the family to find while you're hanging or whatever. It's just absolutely terrible. And the other thing that goes into this, of course, is that the family has to worry about this, and there are families whose loved ones they assist to die.
Some of the palliative care people say that only 2 to 5% of people who are dying have symptoms which cannot be alleviated by palliative care. I don't know why they say only. I mean, this is still a large number of people.
I don't care if it's a small amount of people or a large amount of people. If it's one person, if it's only one, then that needs to change. They need to have the opportunity of dying a death that is peaceful and supported by not only the professionals that are dealing with them, but also their family.
Well, I think there's a little bit of hypocrisy amongst the medical profession, given that many of them, when they're interviewed anonymously, many of them, I think probably over 50%, will admit to the fact that they have given a little bit more to somebody who is in great distress to hasten their death.
And look, I don't want them to do it if they don't want it. It's a free country. I don't want to see doctors forced into assisting people to die. However, there are doctors willing to do that and would have done that for their patients anyway, now illegally. Let's not make them murderers. Let's let them have the dignity of looking after their patients who want that choice in a legal way.
It shouldn't be up to which doctor happens to be on the day, what that doctor's beliefs are. They're entitled to their beliefs and their opinions, but they're not entitled to impose that on their patients. If they have a problem with the voluntary assisted dying, then get someone who doesn't have a problem with that. You just say, I can't do this, or I could refer you to someone who is able to help you out with that.
I'm talking about a beautiful death. I'm talking about a beautiful death. And a beautiful death means that the person who's dying is peaceful, doesn't have any debilitating physical symptoms, and isn't struggling to breathe. To go from that physical aspect to a more sublime and beautiful death, shouldn't they have the option to have it?
Can you imagine how gorgeous that is? Because you can then have your children, your lover, your husbands, your wives, and you can all be there. I get a feeling of this, you know, of real loving death, where everyone is going to give the best kind of emotion to let this person go. And I just think to be able to have that control is absolutely amazing and so wonderful. And it's a sign, I think, of a sophisticated, caring society.
It has to, this change has, legislation has to change. We have to bring these laws in to help people that I've helped by putting their needs ahead of my own. Doctors are doing this all the time. They're doing it all the time. And if they're not, then their patients are suffering needlessly. And if I can be part of a process where people who are currently suffering and are like the people who I have helped, if I can bring about change so those people are helped, this is worthwhile.
And again, it's if they wish it to be changed. You're not imposing that on them. If they wish to change it, I would say yes, and I'm standing up to let anybody who's willing to listen to say, please think about this, and please, if it's a choice between a beautiful death and a very, very difficult death, which one would you want? But when I'm ready to die, I would like a beautiful death. And I feel I'm entitled to it as a human being.
I guess in my time in medicine, which has now been, how old am I, 50 years roughly, and 15 years in federal politics, I got to meet a few people, right? Lots and lots of people, right? And I don't think I ever met a family, literally, who had people or loved ones go, they couldn't recount a very bad result. So this is not uncommon. And I would say to every politician, you have a responsibility, regardless of your faith or superstition or supernatural beings that cloud your world, to have duty of care to the population. This is a duty of care.
I love this thought about WA being the friendly and warm society. And, you know, we say that the reason why we're all so friendly is because we're so pleased if anyone comes to WA, we want to make them very welcome. And in a way, therefore, this legislation sort of fits that West Australian personality, you know. Come on, mate, I'll give you a hand. You know, if you're in need of something, yeah, I'll help you out. And if that means you're going to have a good death, oh sure, let's help you on your way.